So, becoming a doctor can be very challenging. In this video today, I'm going to be talking about the hardest parts of becoming a doctor. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, I get this question a lot from different viewers and different messages, emails, DMs. What is the hardest part of being a doctor along this path? We go through a number of years to reach our end goal of becoming a surgeon or a pediatrician or an anesthesiologist, endocrinologist, and in general, it takes 4 years of college, 4 years of medical school, anywhere between 3 to 7 years of training as a resident, plus or minus 1 to 3 years of fellowship. So it's a very long path, and you have to pace yourself. So I'm gonna break it down from college to medical school to being a resident and just being a surgeon in general. What's the hardest part? I think in college it can be very challenging because it's a transition from being at home with your parents to most people are on their own for the first time. I think in college, a lot of people can find it challenging to juggle their schoolwork with everything else that they have going on. Some people have part-time jobs, some people work on campus, some people are research assistants. If you compare this to high school where you're expected to go to class every single day from a certain time, from let's say 7 a.m. to 2 p.m., and you're expected to be in class, you compare this to college where most classes are really not even mandatory to go to. Some people can find it challenging to stay afloat or to stay disciplined during this time and study when they're supposed to. And let's face it, everyone kind of starts off slow in college, and then you may make some C's, a couple B's, and some A's, but as you progress through the years, this is when most people feel more comfortable with the classes and learning how to manage their time and learning how that they study best. So I think the hardest part of the college aspect of this path is actually just staying afloat and maintaining a certain GPA that puts you in a competitive range for medical school. And this can be quite challenging for a lot of people, depending on your major, how many hours that you're taking each semester. This can be pretty challenging. So during college, most people take the MCAT and then apply to medical school. Medical school is 4 years long, where you spend the first 2 years in the classroom and the third and fourth years in the hospital. And compare this to college, where you're taking anywhere between 12 to 15 credit hours per semester. Well, in medical school, you take anywhere between 35 to 40 credit hours per semester. If in college the professor is going over a particular chapter and he may spend 2 to 3 weeks on this chapter, in medical school you would go over that same chapter in about 1 hour. So there's lots of information to learn in just a short amount of time. One of my professors in medical school kind of described it as drinking from a water hydrant. It's impossible to learn everything that they're teaching you, and it's kind of like throwing mud on the wall. If you throw a lot of mud on the wall, some of that mud is going to stick, but the majority of that mud is actually going to fall off. If you compare this to medical school, you're getting all this information that you're learning from your professors, and you're expected to regurgitate this information and learn it well enough to answer questions for the exam, but most importantly, learn it well enough that you can utilize this information in the hospital to take care of patients. So I think the hardest part of medical school is actually trying to learn all of the information that they teach you in just a short amount of time. I think the people that do well are people that are organized, they're disciplined, and they're not afraid to ask for help. You have a lot of smart people in your medical school class, and it becomes a problem when people have too much pride to ask for help. So the next part of this path to become a doctor is your residency training. Depending on your specialty, your residency can be anywhere between 3 years to 7 years. Pediatrics or internal medicine, some emergency medicine programs are 3 years, but if you're talking more of the surgical specialties, you're looking at anywhere between 5 to 7 years, where neurosurgery can be sometimes 7 years, sometimes 8 years of training. During this time, you're working lots of hours. When I was taking trauma call and my orthopedic trauma surgery rotation, every 3 days I would be on call for 30 plus hours. And even though that you're working all of these hours, you're expected to still go home and read and do research. And every year while you're resident, depending on your specialty, you still have an exam. Every November, every resident in the country took the same exam. It's called the OITE. OITE, Orthopedic in Training Examination. And the hard part of being a resident is actually finding time to study and stay on top of your discipline. So in high school, you go to class, you're expected to go to class, and classes are usually mandatory, and someone is telling you, hey, you need to study this for this particular exam. When you get into college, you have a little bit less of this. There are very few people that are telling you, hey, you need to study this for this particular exam, or you need to go home and study for 2 hours tonight. In medical school, you have a lot less of that, and as a resident, you just don't have anybody telling you what to study and when to study. So I found it most challenging to come up with a study plan myself that I can study throughout the year so that I would be prepared for my in-training exam in November. So in addition to your call responsibilities, your OR responsibilities, your research requirements, you have to find time to study. And the days that I work anywhere between 11 to 14 hours a day, I still had to go home and study. So I think the hardest part of being a resident is trying to find the time to study. So from college to medical school to residency, it can be very challenging along this path to try to keep up with everything that is required of you. And throughout this whole path, I think the most challenging thing kind of overall going through the years from college to medical school to residency and even fellowship, I think the hardest thing about being a doctor is actually work-life harmony. Most people would call it work-life balance. I have other videos about this and I'll put it right up here. Jeff Bezos, who's the founder of Amazon, as well as Dave Ramsey, they like to call it work-life harmony. And essentially this means that if you're happy at home, you have a happy wife or a happy family, then you're most likely going to be happy at work. And even though I've been on this path for the last 10 or 11 years to try to become a surgeon, this has been the most challenging part of my path. When do I study? How much time do I spend studying? When can I take off and go do something that I like to do, my hobbies, or go to the movies, or just don't do anything at all? Because you'll realize that every time that you're actually not studying or actually not doing any work at all, you're questioning yourself. Should I be studying, or should I be doing this? Or what about this research project? Or what about this surgery that's coming up? It's hard to completely turn off the medical lifestyle. And that's been the most challenging thing for me, and I still haven't figured this work-life harmony thing out. So, what are your thoughts? What has been the most challenging aspect along this path? I would love to hear from you. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.